Thank you for taking the time to view this presentation today. Public Health developed this to provide background information for stakeholders participating in the engagement process for the development of an Alberta strategy for sexually transmitted and blood-borne infections. A survey will be available online until April 24, 2025 as the first opportunity to share thoughts, ideas, and feedback. Information collected through the survey will be used to inform decisions on whom to meet with individually, as well as to develop discussion questions for a series of in-person and online engagement sessions, where stakeholders can share their professional experiences, perspectives, and lived experiences regarding STBBI prevention and the cascade of care. All of the information gathered across the engagement will be used to inform strategy development. The previous STBBI strategic framework was developed to guide Alberta Health Services and community-based organizations in the work to reduce the incidence and rates of sexually transmitted and blood-borne infections in the province. It expired in 2021. It provided guiding principles for 6 key action areas: prevention, early detection and diagnosis, treatment, support and care, raising awareness, and addressing stigma. The framework was created following discussions and work with more than 350 organizations during engagements held by Alberta Health Services in the summer of 2016. With the framework expired, we now have a chance to create a renewed strategy to guide future actions and align with the current needs and priorities for STBBI in Alberta. The new strategy will build on successes and lessons learned from the previous strategy, while incorporating new opportunities to reduce the impact of STBBI, improve public health outcomes, and advance overall health and well-being. This engagement underscores the Government of Alberta's commitment to gather input from diverse perspectives to better understand the complexity of addressing STBBI in Alberta. As we move forward with developing the strategy, we will focus on tackling the current syphilis outbreak and rising rates of chlamydia, gonorrhea, and HIV. The strategy is intended to set clear strategic priorities, goals, and objectives for the next 5 years. Just as importantly, it will look to incorporate First Nation, Métis, and Inuit perspectives and Indigenous ways of knowing to ensure that our approach is inclusive of all people living in Alberta. By doing this, we aim to create a strong foundation for collective efforts in prevention, identification, and care, enabling the community-based organizations, provincial health agencies, and communities to collaborate effectively and improve health outcomes for everyone. In Alberta, there are 9 reportable sexually transmitted and blood-borne infections. For the strategy, we are focusing on 6: syphilis, gonorrhea, chlamydia, HIV, hepatitis B, and hepatitis C. HPV, although not reportable, is also a focus of the strategy as it is one of the most common sexually transmitted infections. In fact, more than 70% of sexually active individuals will contract HPV at some point in their lives. We selected these based on their infection rates, overall health impacts, and the potential for prevention, treatment, or cure. Concentrating our efforts on these infections while continuing to consider all STBBI with the intent to improve health outcomes for everyone living in Alberta.
Over the past decade, Canada, like many other countries, has experienced a rapid rise in bacterial STIs. While chlamydia cases have recently declined, they remain high overall, and HIV rates, which had previously been stable, are currently on the rise. Despite having an effective vaccine for hepatitis B and curative treatments for hepatitis C, Canada has not achieved the decreases hoped for in either infection. Infectious syphilis in particular stands out for its increases. In 2022 alone, nearly 14,000 cases of infectious syphilis were reported. That is double the number from 2018. This rise in cases spans almost every province and territory, with prairie provinces seeing the most dramatic changes. Once primarily seen in marginalized communities and amongst gay and bisexual men, syphilis is increasingly common in heterosexual populations now and among women of reproductive age. This has led to an alarming surge in congenital syphilis, which can have devastating outcomes: miscarriage, stillbirth, prematurity, and neonatal death. Congenital syphilis is entirely preventable when detected early in pregnancy. However, in 2022, Canada saw a case rate of 31.7 cases per 100,000 live births. The true burden is likely higher within Canada, as probable cases are not included in this data. The numbers highlight just how urgent it is to address syphilis and all sexually transmitted and bloodborne infections at national and provincial levels to ensure that prevention, testing, and treatment efforts can reach everybody who is at risk.
The Government of Canada released a 5-year action plan on sexually transmitted and bloodborne infections, outlining priorities, actions, and commitments for implementing the Pan-Canadian STBBI framework for action. The renewed action plan builds on the progress to date, reaffirms Canada's commitment, and integrates advances in science and research. It focuses on health equity and equity-deserving populations, acknowledges post-pandemic realities, and incorporates stakeholder and partner insights and expertise. Although Alberta Health supports the Canadian framework in principle, Alberta has its own unique challenges and opportunities to tackle. That is why we're pursuing our own provincial strategy, one that acknowledges and contributes to national efforts while addressing Alberta's specific needs and priorities. Alberta has seen a significant rise in STBBI rates over the last decade, especially for syphilis and congenital syphilis. Syphilis has been a critical concern, with a provincial outbreak declared in 2019. Alberta rates continue to be higher than the national average. Both syphilis and congenital syphilis rates reached their highest levels in 2022. Congenital syphilis peaked at 174.8 cases per 100,000 births, before declining slightly to 121.6 cases per 100,000 births in 2023. For context, congenital syphilis was rare in Canada, with only 1 to 4 cases reported annually from 1993 to 2004. This underscores the importance of sustained prevention and treatment efforts to address this growing challenge. Infectious syphilis rates remain staggering. While 2023 did mark a low, with rates dropping to 58 cases per 100,000 compared to 73.5 cases per 100,000 in 2022. This is well above the rate of 11.3 cases per 100,000 seen in 2017. Non-infectious syphilis rates, the result of an untreated syphilis infection, have been rising in Alberta since 2020, and the rates of chlamydia and gonorrhea increased by approximately 5% from 2022 to 2023. From a geographical perspective, Alberta's STI rates have been highest in Edmonton and northern Alberta. For HIV, rates have nearly doubled since 2019 in Alberta, with 507 cases reported in 2023. About half of these cases were likely acquired outside of Canada, meaning it's a new case for Canada, but not necessarily a new diagnosis for the individual. And about half of the cases were newly acquired within Canada. Most of these cases have been reported in Edmonton and Calgary zones. Chronic cases of hepatitis B have also been on the rise. However, hepatitis C rates have been declining, with both acute and chronic cases dropping in recent years. Although we face a number of challenges in addressing STBBIs, each challenge presents its own opportunity for innovation and improvement. For example, we often hear that there is a lack of awareness among the public and some healthcare professionals about the rising rates of STI and the syphilis outbreak. There is an opportunity to address those by increasing opportunities for provider training, normalizing sexual health, and encouraging open conversations to better reduce stigma. The rise of emerging and re-emerging infections creates an opportunity to explore advancements in testing and treatment to ensure faster, more effective care. Intersecting issues such as substance use, houselessness, mental health concerns require cross-sectoral collaboration as an opportunity to address root causes and support vulnerable populations. Access barriers remain a concern. However, there are opportunities presented in virtual healthcare services, expanded roles for healthcare providers such as pharmacists and nurses. And finally, the work to refocus our healthcare system, while challenging, provides an opportunity to better integrate services and create a more effective, patient-centered approach. If we can reframe challenges as opportunities, we can make meaningful steps to strengthen STBBI prevention and care in Alberta. The renewed strategy will outline priorities that align with public health goals and the unique needs of Albertans. We want to focus on tackling key challenges and improving outcomes across the province. First, we aim to curb the syphilis outbreak and prevent prenatal congenital syphilis, which is a critical issue. Beyond syphilis, we're also focused on reducing rates of all sexually transmitted and blood-borne infections, especially among vulnerable and priority populations. We want to improve health outcomes by addressing adverse impacts of STBBI while ensuring greater equity in services. This includes looking at what equity can mean for Indigenous peoples, rural and remote communities, and individuals facing systemic barriers. We recognize the need to continue to improve cultural safety and competence in how services are delivered, while working to reduce stigma around sexual health and STBBI. Finally, consideration of opportunities to improve collection, use, and the sharing of data is important. Data analytics help guide decisions at provincial and service levels to support effective and targeted services. Achieving these things will require a collective effort to build a healthier and more inclusive future for everyone in Alberta. As we began planning for engagement and development of a strategy, we developed a draft list of priority populations. These populations reflect the diverse realities of individuals and communities, often most impacted by STBBIs. This broader approach was intentional and based on three key factors: data that shows higher infection rates, research identifying groups more likely to experience adverse health outcomes as a result of an STBBI, and the barriers that many face in accessing STBBI services, which include stigma, discrimination, and a lack of supportive environments. We have used inclusive and neutral language as much as possible and avoided terms like at risk. This ensures that individuals and the organizations supporting them can see how they connect to the strategy. Our goal would be that people with lived or living experience feel represented, and that the strategy acknowledges the intersections of identity and experience that shape access to care and health outcomes. It is important to note that many individuals may identify with more than one group on this list. These intersections emphasize the need for an approach that is flexible, inclusive, and responsive to the complexities that exist within people's lives. Thinking about what we wish to achieve and building on the strengths and possibilities, our vision aims to create a future where STBBIs are rare and everyone has the knowledge, support, and capacity to maintain their sexual health free from stigma or discrimination. Achieving this means combining innovative education, accessible testing and treatment, and a focus on collaboration across sectors. If these pieces can come together, we can empower individuals to make informed decisions about their sexual health and help reduce sexually transmitted and bloodborne infections across our communities. This vision is more than just reducing infection rates. It's about ensuring that well-being, respect, and equity are part of the foundation of an approach to sexual health. Displayed on the screen are the initial areas of focus that are being considered for the strategy. Not surprisingly, 3 of these areas reflect the cascade of care: prevention, education, and awareness, testing and treatment, equitable access and coordination of care. The 4th area, data analytics, research, and evaluation, is essential for driving decisions and policies that support those first 3 areas. Innovation and enabling supportive environments are also recognized as a foundation for making any progress in any of those areas. Enabling supportive environments refers to the interrelated social, cultural, physical, and structural conditions needed to support both the individuals accessing STBBI services and those who are working within the cascade of care. Innovation, as a foundational element, must consider new concepts, ideas, technologies, processes, and services. This image serves simply as a starting point for discussions about what areas of focus should be included in the strategy and what specific strategic actions could contribute to these 4 areas or other priorities. We believe that collaboration and coordination should be at the core of a renewed strategy. We recognize that achieving meaningful change will involve everyone: people from Alberta Health Services, provincial health agencies, community-based organizations, communities, people with lived and living experience, all working together under a unified vision. By embracing a shared vision, we can ensure that each partner's insights and expertise shape how the strategy unfolds. Ongoing communication keeps us aligned on goals and progress, allowing us to adapt quickly to new challenges or new opportunities as they arise. It is this collaborative approach that can drive success on a renewed strategy and improve health outcomes for everyone. We appreciate you taking the time to watch this background presentation. The purpose is to give you a starting point as you prepare for the upcoming survey or one of the discussions. Your role in this process is essential. Whether you bring lived or living experience, professional expertise, or a unique community perspective, your insights are valuable, and we appreciate the experiences and knowledge that you contribute. These things are key to shaping a strategy that is practical, inclusive, and responsive to the realities of STBBI in Alberta. As we move forward, we encourage you to reflect on what resonated with you from this presentation and how your role connects to the topics we've discussed. Over the next several months, there will be opportunities to share your thoughts and insights. Together, we can ensure that the strategy reflects diverse voices with an opportunity to create meaningful change for individuals, communities, and the province as a whole. We look forward to hearing from you and working together towards the development of a strategy. If you have questions about the engagement, opportunities to attend engagement sessions, or the development of the strategy, please send them to the team at stbbiaction@gov.ab.ca.